I am a professor of internal medicine and health behavior and health education. I'm what you would call an interventionist. My passion is really how do we think about designing programs and how do we then evaluate them, hopefully with the idea of scaling them up and implementing them. When I went to medical school, I realized that I was always going to be interested in not just thinking about individual care, but how do we design systems that better support patients? How do we create linkages between primary care and community resources? Really, the problem that I focus on is recognizing, especially people living with chronic conditions like diabetes, heart failure, heart disease, most of what determines their health is what they have to do between face-to-face clinic visits. And so a lot of what I do is thinking about how do we better extend support between face-to-face office visits. We've been studying a range of different strategies to do that. How can we better mobilize peer support? Can we train patients themselves to provide support to each other? We've done a number of randomized controlled trials showing that community health workers can improve diabetes outcomes. I've also done a range of interventions showing the effectiveness of different models of peer support. Dyads of patients helping each other, patients being trained to provide peer support. And then finally, can we better mobilize mHealth tools? Better use of text messaging, e-health, interactive, tailored tools. So all the range of ways that we can better extend support beyond the clinic itself. A lot of my work has been on showing that individual interventions are effective. And I think one of the exciting things with IHPI, can we better think about how we can scale that up in the real world, beyond one or two clinics, one or two or three health systems? Can we work together with the health plans and really target certain neighborhoods and have the health plans collaborate so that we can have a community health worker that isn't just working for one health plan, but is working across health plans, targeting all the conditions in a certain neighborhood that are making people sick, making people go to the hospital. Can we really make a difference? So I'm very excited about that IHPI project. I don't know really of any other institution like this at any other medical school that I've been to recently, where you have this kind of concentration of interdisciplinary experts focusing on health policy, focusing on how do we improve care, how do we improve health systems. It's very exciting. I mean, space matters. Having us all together in this remarkable space and also having the structured activities, the seminars, the talks, I think really creates a lot of opportunity for informal contact, for exciting chance encounters, and for really helping us innovate. So I think IHPI is nudging a number of us who are very happy doing our academic studies. We love testing our theories and seeing what works, but to really push us so that we're actually doing experiments out in the real world that are having a direct impact in a much quicker time frame than we often are used to in academia. Obviously, the Accountable Care Act has created opportunities. I mean, we are seeing people that never had health insurance before now having health care coverage. We're seeing new payment models, and I think there's a lot of very exciting reforms. There's a lot of exciting experiments now. So I think my vision would be that by doing some of this rigorous evaluation, that we can show that this really works, that this is not only better for health, but may actually end up bringing costs down.